Jane Cyril. I'm from the Alzheimer's Association. I'm a volunteer community educator. And Elaine is wonderful enough to be going around with the attendance sheet. If everyone can just put their name, I'll get the zip code here because I know you all live here. I don't need your address or phone number. It's just I'm giving my director how many lives we've touched. Okay, you're not going to get anything. We're not selling anything. Okay, because I know sometimes people are worried about that. But I just wanted to let you know that. So if you have not signed in yet, if you can raise your hand and Elaine can bring you the paper. Okay. All right, she's just in the back and then she'll get to all of you. Okay? So, okay. Can you hear me okay? All right. Thank you so much for coming today. This is wonderful. Yesterday I had about 20 people at the location I was at, and it's so great to see this many people who are interested in finding out what are the 10 warning signs of Alzheimer's and other dementias. Okay, and when we talk about Alzheimer's, I used to do a lot of heart workshops, and with heart, what we would do is have everybody think of an umbrella. Okay, we don't need an umbrella today unless you are worried about sunburn and you put one up out there. But if you can think of an umbrella, and that would be heart disease. And underneath, can everybody raise their hand who didn't get a handout? And Annette will give them to you. Okay, if you can think of an umbrella, heart disease or cardiovascular disease, and underneath that, you have high blood pressure, atrial fib, heart attack, stroke, congestive heart failure. Just like that, with dementia being the umbrella term, you have numerous different causes, such as we have vascular dementia. And I'm going to tell you about that in a minute because that's personally why I'm doing these workshops. My mom had vascular dementia. But there's people who have Down syndrome can develop, unfortunately, dementia from the Down syndrome. Huntington's disease, there's another type of dementia. There's Parkinson's dementia. And 60 to 80% of the dementia cases that are out there are Alzheimer's. That's the most severe type. Okay, so you have that umbrella, all the different types, and the most is Alzheimer's. That's the 60 to 80%. We're going to talk about that a little bit today, okay? And I just want to show you, this is why I got involved with the Alzheimer's Association. This was my mom, her high school picture and later in life, and she suffered for about 15 years with vascular dementia after she had a stroke. Okay, and initially it was just a lot of repeating herself. And then, unfortunately, it got worse. Okay, she became combative, and we'll go over the signs to watch for. But eventually we put her in Philadelphia Protestant home. And I just want to tell you about her last day because my sister had called and they had called her and said, "Mom's not doing well, you better come." So my husband Skip and I went down to see her. It took an hour to get to. It was pouring rain and it was at the end of COVID. So we went in the room and he's on this side, I'm on this side. And I just said, "Mom, it's Jane Ellen," because she always went by my middle name too. And she didn't do anything, and all of a sudden, Skip was on this side, and she opened her eyes. I'm like, oh my goodness, her eyes are open, because she was in bed, and she wasn't eating, and, unfortunately, it was the latter part of her dementia. I ran over to my husband's side, because her eyes were open, and he's there, "Would you take the mask off? She doesn't know who you are." So I took the mask off and she smiled. I don't know if she was smiling because she saw it was Skip and I, or did she smile because we were putting on a comedy act? Take that mask off. So it just made us start crying, and we were so happy because about 3 hours later she passed. So I do. You know what? We can just put it on here for now. Okay, thank you so much. Or they can even put it on the back of one of those sheets. Yeah, okay. So that just made me so happy to know we saw her at the end. And then we had a funeral for her a few days later. But that was her story. She unfortunately had it for quite a while. So, and I will talk to you about that. I do want to show you a couple other pictures too. I don't know if any of you remember Dave Frankel. He used to be the weatherman on Action News going back 25 years ago. Okay, and my daughter was little then, and we'd have the 12 o'clock news on, and she'd say, "Oh, Mommy, doesn't Dave Frankel remind you of Guy Smiley on Sesame Street?" And I said, well, I never thought of that. But I said, why don't you color him a picture and we'll send it to him. So we sent him a picture, and I told him how Anna thought he reminded her of Guy Smiley. And he sent a picture and sent a letter back. And I thought that was so sweet. The reason I'm telling you this, he went on to law school and became a lawyer after he did his weatherman stint. But unfortunately, he just recently died of frontotemporal dementia. Okay, and he apparently, from what his wife said, battled with it for quite a while. So, I don't know if you remember Dave Frankel, okay? But along with him, I wanted to show you that this doesn't hit one type of person. There was a man named Stanley Friedman. He was 93. He was an architect. He was a city planner. And he designed the King of Prussia Plaza in 1963. He unfortunately passed away from Alzheimer's. So it doesn't matter. It can happen to anybody, any race, any income bracket. But the important thing is to get it, if you have symptoms, to get it diagnosed, to see your doctor. Okay? I do want to tell you a few statistics before we start. Over 7 million Americans are living with Alzheimer's. That's just Alzheimer's. When you include all those other types of dementia, it's way over 7 million. Okay, like the vascular dementia my mom had, like Parkinson's dementia, okay? 1 in 3 older adults dies with Alzheimer's or another dementia. And between 2000 and 2022, deaths from heart disease have decreased 2.1%. Okay, so we must be doing something right. Maybe people are going to the doctors and getting their blood pressure controlled. If they had a heart attack, they're doing something, getting their exercise and eating better. However, deaths from Alzheimer's disease have increased 142%. So that's quite a jump. Okay, it kills more than breast cancer and prostate cancer combined. And up to 4 in 5 Americans feel optimistic about new Alzheimer's treatments in the next decade. 92% would want a medication to slow the progression of Alzheimer's following a diagnosis. And that's really important because in the past 5 years, research has been exploding with medications. We do have a blood test now, which we're going to talk about, but they have new medicine. I did a workshop in Montgomery Township, and usually you see it more in people over 65, but this gentleman raised his hand. He said, I'm 50, I'm a marathon runner, and I was diagnosed with early stage dementia, or early stage Alzheimer's. I am on medication to slow the progression, and the progression of my disease, my Alzheimer's, has not gotten any worse. So that is so hopeful to him and to so many other people that it won't progress like my mom's did, that she was in bed and not speaking. His hopefully will continue to work for him and slow that progression down. Okay, and you may wonder, well, why is Alzheimer's rates increasing, not only in the United States or globally. Well, there's been advancements in medical technology, changing lifestyles. Although I said some people who have high blood pressure get it treated, some people who have had heart attacks now are leading a healthier lifestyle. Since COVID, a lot of people are couch potatoes. A lot of people are not eating right, okay? So what we have to do is really try to get better sleep. We have to try to eat healthier. That DASH diet, the Mediterranean diet, and Harvard has the MIND diet, which is a combination of both of those diets. More fruits, more vegetables, especially green vegetables, more berries. Berries are real good. Whole grains, okay, lean meat and fish, okay, they are really good for you to eat. Also, along with the advances in medical technology and a sedentary lifestyle, we have to get up more. Okay, American Heart says if you can get about 30 minutes of physical activity a day. Now, you may think, oh, I'm never going to get 30 minutes in. You could break it up, 10 minutes, 10 minutes, and 10 minutes. How many of you watch TV at night? Okay, do you like the commercials? Okay, turn that TV remote down and get up and walk. Okay, just walk in place or stretch, okay? But do something moving that'll get that blood circulating, not just to your heart, but to your brain. Because what's good for your heart is good for your brain. That's something in my other workshop I stress to people because we have a workshop on healthy living for brain and body. And it's so important if you watch your salt intake, if you get enough sleep, if you watch your stress level, that's not only good for your heart, but it's good for your brain, okay? Also, as far as why Alzheimer's rates are higher now, there's increased awareness and diagnosis. And a lot of doctors know now, and we'll go over this, that there's other specialists they can refer their patients to get treatment. So we will be talking about that in just a couple minutes. Okay, and also it can happen in the family. Okay, you may have a family history. We have a family friends who both parents had Alzheimer's. Now all three children, they're all in their 50s, have Alzheimer's. Okay, unfortunately, you know, they were not aware of that family history and gene problem that they had. Along with that and the lifestyle, there's environment. And a lot of information has been written about the environment we live in. Okay, pollution, pesticides, vinyl chloride, formaldehyde, benzene, all of these cause problems in the environment, but we breathe it in. I have an article from September 2024. We all remember 9/11. Those first responders ran in there. They didn't care that they weren't masked, okay? However, they weren't masked. And they inhaled all the noxious fumes. They inhaled the dust. And it was neurotoxic debris. And unfortunately, a lot of those first responders had cancer, died. Many of them now are showing signs of dementia. And the federal government, they've been pleading with the federal government to please help us. We were the first responders, and now we have dementia. And it's really unfortunate they're not getting a lot of help. Okay, so we do have to, you know, if you talk to your elected officials, say, don't forget 9/11 responders. And I don't know how many of you remember a few months ago, SPS Technologies in Jenkintown had a big fire. And they had a lot of chemicals. Now, I don't know if the firefighters who went in had masks, but I'm praying they did, because again, we could see an increase in inhaled problems, which not only could affect their body, but their brain. Okay? So it's always important to, you know, keep your masks handy. Okay? I know I still see people with masks on. And it's important because my neighbor just had a bad bout of COVID. She was in bed for 4 days. So it's still around, and as you know, a lot of sickness is still around, and if we're outside, unfortunately, there's a lot of pollution out there. Okay, so what are we going to discuss today? We're going to discuss the typical age-related memory, thinking, or behavior changes. And on those handouts I gave you, or actually Annette gave you for some people, thank you so much, they have quite a few age-related, can I borrow that for a minute, sir? Okay, a typical age-related changes listed, but they also go over the warning signs. So I know you probably, thank you, you probably think, oh my gosh, I lost my keys, I don't know where they are. And then all of a sudden you're like, oh, I put them right next to the phone. Okay, that's fine. Okay, you remembered. We worry about the people who put their shoes in the freezer and then accuse a loved one that they put them there. Okay, we're going to go over some scenes like that. Okay, but recognize common warning signs of Alzheimer's and dementia. Discuss the tips for approaching someone about memory concerns. Explain the importance of early detection and benefits of diagnosis. Identify possible tests and assessments for the diagnostic process. And name the resources available through the Alzheimer's Association. I do have more pamphlets up here if you did not get one. I have some in the back still, but the main thing I want you to see is the back. On the back, alz.org is a website you can go on. They have a ton of information for you to get if you need it. The most important number is there, the Alzheimer's phone number. It's masters trained clinicians who can answer your questions, and if they don't know the answer, they will get back to you. Okay, so it's really important to keep that number handy. I had called them numerous times with my mom, so it was great to have that resource. This is online caregiver resources. We have around the clock information, and take care of yourself. If you're a caretaker, don't forget about yourself, because you are the one who needs self-care and needs to take a break and, at times. All right? We're going to be talking about a family. They're a fictitious family. Mary is a 73-year-old widow. She's a retired teacher. She's always been meticulous with caring for her house. And her daughter Lydia has recently been noticing laundry piling up at her mom's and junk mail and old newspapers just lying around her house. And that was so unlike her mom. Now, Lydia is the person on your left. Can everybody see her okay? Okay. She's the eldest of Mary's 2 daughters. She lives a few miles away and visits her mom frequently. Her other daughter, Patricia, lives in another state. She works long hours and isn't able to visit her mother as often as she'd like, but she does communicate over the phone and text messaging with her mom, as well as with Lydia. So they had a conversation about their mom. Worried about mom, she keeps losing things in the house, and the house is a mess. Okay, probably normal to get a little forgetful with age. It's so unlike her. Should we worry? Let's reach out to our old neighbor, Dr. Salloway. Now, Dr. Salloway is a true medical doctor. In fact, he's an expert in Alzheimer's care. Okay, so what you hear here is true. He is a true doctor.
Get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
Okay, we are here today to learn more about Alzheimer's and dementia. And a lot of times people think both those terms, Alzheimer's and dementia, are interchangeable. However, there are significant differences between the two. So we're going to find out a little bit about the two terms. And this is Dr. Snyder.
Dementia is an umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain, or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual. But there is also some overlap in behaviors among the types of dementia.
Believe it or not, you wonder, well, how'd you get that name, Alzheimer? There was a Dr. Alzheimer, okay? So there was a man named Dr. Alzheimer. And we are going to learn what is Alzheimer's disease from Dr. Kurilla.
More than 100 years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles. Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brain stem. Each one plays a role in how the body functions. Alzheimer's disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's, such as memory loss, behavioral issues, problems with thinking, planning, and at the end stage, swallowing.
Okay, and why is it important to know the signs? We're going to hear from another expert related to that.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things, but when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with. Some of the things that can look like Alzheimer's may be other treatable conditions. If it is Alzheimer's, you still want to know as early as possible, because that gives the person and the family time to plan, time to make decisions, and it also gives the person with the disease a voice and allows them to say what they want.
Okay, again, changes in a person's memory, thinking, or behavior. So these are the 10 warning signs that are on your sheets, and we're going to go over each one, starting with memory loss that disrupts daily life. Okay, this is one of the most common signs of Alzheimer's, forgetting recently learned information. Okay, maybe it's forgetting important dates, asking the same questions over and over. My sweet mom did that. She constantly said the same thing over and over. When we knew her diagnosis, nobody said to her, "Would you stop saying that?" You just kept answering the same way. Increasingly relying on memory aids such as reminder notes or family members for tasks formerly managed with ease. A typical age-related change is sometimes forgetting names or appointments, but remembering them later.
I was probably spending 4 to 5 times more time preparing for something than I did, say, 5 or 10 years ago, because of I would lose my thought, I'd lose my focus, I'd get anxious, I wouldn't get to sleep. I was thinking, I was in my sleep, I was thinking about what I was anxious about, which was what I was trying to remember, which was what I was trying to prepare, which I was trying to do. So it was a really a vicious circle of, so I was able to control it a lot, so that people on the wouldn't see things, and that there weren't things to be seen. It's what was disturbing me was what effort I had to put into to do the things I used to do more easily.
Okay, and this gentleman was actually just telling us about that second sign to watch for. Some people may experience changes in their ability to develop and follow a plan or work with numbers, which may result in trouble following a familiar recipe or keeping track of monthly bills, or difficulty concentrating and taking much longer to complete tasks. A typical age-related change is making occasional errors when managing finances or household bills. My mom used to make meatloaf, and she had a special recipe, and we all loved it. And then as she was diagnosed, all of a sudden new ingredients were in the meatloaf that never were in the meatloaf before. So that's something we realized, hey, that wasn't her norm, because she used to do it without even looking at a recipe. Okay. Number 3, people living with dementia commonly have difficulty completing daily tasks such as driving to a familiar location, organizing a grocery list, remembering the rules of a favorite game. And what's a typical age-related change? Occasionally needing help to use the settings on a microwave or to record a television show. I don't know about you, but we just got a new big TV, and it came with a remote, but it's just not on off. You have to go into a program to go into a TV station, and I'm like, when did this all change? Where's the 3610 dial? So I was kind of shocked. So remembering, how to use a remote, I had to go back to the handbook. So we're going to hear from the expert on this difficulty completing tasks.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
Okay. Number 4, people living with Alzheimer's or other dementias can lose track of dates, seasons, and the passage of time. They may have trouble understanding something if it's not happening immediately, or they may forget where they are or how they got there. This happened a lot during COVID because a lot of people were stuck at home. They were isolated. So, it was really important to have socialization, even if it was standing outside on one side of the street and other people were on the other side. Just communicating, or communicating over the phone or on the computer. A typical age-related change, getting confused about the day of the week, but figuring it out later. For some people, having vision problems is a sign of dementia, which may lead to difficulty with balance, trouble reading, or problems judging distance and determining color or contrast, which may cause issues with driving. A typical age-related change is vision changes related to cataracts. They noticed, and there was a recent study done that said a lot of people who have vision trouble have some cognitive impairment because they may stay home because they don't want to go and possibly fall, or they don't want to deal with driving when they can't see what they're doing. Also hearing. If people can't hear right, they will isolate themselves and stay back in their room and not socialize. Socialization and cognitive engagement are 2 really crucial things we encourage people to do. Reading books, puzzles, word searches. Sudoku. They're really important to open up pathways in your brain. Okay, so you want to do that. And if you have trouble hearing, if you can't hear me today, definitely make an appointment to get your hearing checked. You may need hearing aids.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing, and in fact, their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
With that in mind, what she's saying, a lot of people who have trouble with balance, they'll fall a lot. And they found that people who fall a lot may have an increased risk of cognitive decline. So if you're falling a lot, tell your doctor and have him or her check your balance to make sure it's not a balance issue. People living with Alzheimer's may have trouble following or joining into a conversation. They may stop in the middle of a conversation and have no idea how to continue. They may repeat themselves quite a bit, struggle with vocabulary, or have trouble naming a familiar object or use the wrong name. Age-related change, which is typical, is sometimes having trouble finding the right word. We're going to hear from Phil, and you'll hear how he just stops and can't think of the word.
The other thing that I've increasingly been struggling with the words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
And he was so good with words before he developed this. Okay, a person living with Alzheimer's may put things in unusual places. He or she may lose things and be unable to go back over their steps to find them, or accuse others of stealing, which may occur more frequently over time. A typical age-related change is misplacing things from time to time and retracing steps to find them later. My mom would lose her purse, and she'd say, "Where did you put my purse?" And she'd accuse us of stealing it when we didn't steal it. We had to look all over the house to find it, but, you know, it was her moving it, not us. So here's another discussion.
So some people wonder if, if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And one thing that I would say about that is for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in, they set their keys down in an unusual space, and there they are next to the phone. If that happened to you or me, we'd probably remember, oh yeah, the phone was ringing when I came in the door. I put down my keys. The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things in Alzheimer's.
People living with Alzheimer's may experience changes in judgment or decision making. They may use poor judgment when dealing with money or pay less attention to grooming or keeping themselves clean. A typical age-related change, making a bad decision or mistake once in a while, like neglecting to change the oil in the car. Now we're going to hear from Teresa, who you'll see she dresses really nicely, but unfortunately she noticed how her house was being left.
The way I count my house, and all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually looked like it was someone's office, because I always would say I will do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet wreck, but really I was, because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
A person living with dementia may experience changes in the ability to hold or follow a conversation. As a result, he or she may withdraw from hobbies, social activities, or other engagements, or have trouble keeping up with a favorite team or activity. A typical age-related change, sometimes feeling uninterested in family or social engagements. My mom used to love watching the Phillies game with my dad, and she'd wear her Jimmy Rollins shirt. And then it got to the point where she didn't know where her Jimmy Rollins shirt was anymore, and she stopped watching the Phillies games.
One of the most common changes, and early on, is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable, but that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. Can be one of the early signs of Alzheimer's.
Okay, believe it or not, we're on number 10. People living with dementia may experience mood and personality changes such as becoming confused or suspicious or anxious or fearful, or getting easily upset at home with friends or when out of their comfort zone. A typical age-related change is developing very specific ways of doing things and becoming irritable when a routine is disrupted. Now, at one time or another, maybe your kids come over and they change the way you have things, and that can get you upset, and that's okay because you have your routine, but this is significant, okay? Typical age-related change, developing very specific ways of doing things and becoming irritable when a routine is disrupted. Maybe some of you have had that happen. So here we're going to hear from the expert again.
Another early sign of Alzheimer's or dementia is subtle changes in behavior. So all of a sudden, the family may notice the person is more easily irritated, or more impatient, or a little moody, or have a shorter fuse, or more anxious. Now, there's lots of things that can cause that, but often that can be an early symptom of Alzheimer's or go along with the early symptoms of memory loss.
Okay, so Dr. Salloway has given us a great recap, and we're going to just change the slide here so you can see. Let me see here. Well, there was a recap that we would go to. The warning signs are intended to be a guide to help identify problems in thinking, behavior, or memory. And individuals may experience one, all, or some of these signs in varying degrees, but you don't have to have all of those warning signs, okay? You may just have one. Okay, so did you look at the warning signs info I sent? This is back to the Garcias. I did, but still don't know. Mom's showing a couple signs, but not all of them. How do we know if it's serious enough to see a doctor? Let's check with Dr. Salloway.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really even, no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And and usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people. But they don't have to check off all the boxes.
Okay, what has changed from the normal daily functioning? Okay. Here are the recap important information for you. These 10 signs are a guide to identify problems that may be related to Alzheimer's. Individuals may experience one or more warning signs in varying degrees, but they don't have to experience all for there to be a concern. And if you notice any signs in yourself or someone else, it's important to see your doctor. Our next topic is early detection. It's key that we pay attention to what's going on with our cognitive health and not dismiss any changes in ourselves or others around us as normal aging. Any change that's unusual for your level of functioning or that of someone around you is cause for concern. Many times friends or family are the first to notice changes in someone's memory, behavior, or other abilities.
It's a very interesting phenomenon that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. So the person is just not keeping track of the trouble they're having day to day. But the family members are, paying attention. If they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
Okay, and we're going to hear from Mary. She is a caretaker for her husband.
I was all adamant about what was happening to Daryl. I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. Daryl was my husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
Okay, so if you see changes, definitely have a conversation with the person. The Alzheimer's Association has developed a roadmap of 10 helpful steps to help make addressing memory concerns less daunting and more productive. So we're going to take a look at that. That's what it looks like, and we're going to go through each. What changes in memory, thinking, or behavior do you see? What else is going on? Okay, are they not sleeping right and they're finding that they're not as alert as usual? Or did they just have a medication change, like maybe they're on a new cholesterol medicine? And we're going to talk about this, but some medication can cause dementia-like symptoms. Is it a medical condition? Do they have uncontrolled high blood pressure, uncontrolled blood sugar, or do they have a real high LDL or bad cholesterol that has not been taken care of? All of these can cause dementia-like symptoms. Learn about the signs and benefits of early diagnosis, having a voice. Has anyone else noticed the changes? Family members, other family members, or friends? Have a conversation. Now, who should have the conversation to discuss the concerns? What's the best time and place to have a conversation? If the person starts showing signs of sundowning, that means getting aggressive at night and getting more confused, that's not the time to have a conversation with them. Maybe when they're alert in the morning with a cup of tea, you can sit down and say, Mom, I noticed that, you're losing things quite a bit, or you're repeating yourself quite a bit. What will you or the person having the conversation say? Offer to go with the person to the doctors. And this is important because you don't want them to go by themselves. And it's a good idea to have someone with them because you can make some conversation with the person and say, there are lots of things that could be causing this. Let's see if the doctor can help us figure out what's going on. I think it would give us both peace of mind if we talk to a doctor. Or the sooner we know what's causing these problems, the sooner we can address them. If needed, have multiple conversations. Remember, this person is repeating themselves a lot. So you may have to say quite a few times, Mom or your sibling, I think it's a good idea for us to go to the doctors. Reach out for support. And you can reach out to the Alzheimer's Association with that toll-free number that I gave you in your pamphlet, or go online at alz.org. Turn to the Alzheimer's Association for information and support. Seeing the doctor. This is so important because the doctor can go over with the person all their medications. And it's important to have, if you don't, have just a 3x5 card with all your medications listed. Not only your prescription medicine, but over-the-counter medicine you're on and supplements. Sometimes some of your supplements may interact with your prescription medicines. So you want to make sure you have a medication review with your healthcare provider. That's really important. The doctor may, when you go to the office, may give you a sheet, like a patient health questionnaire, and it may be what's called a depression assessment. Some of the questions, I have this when I'm sitting in the office waiting for my appointment. They give a paper to me, and little interest or pleasure in doing things. Feeling down, depressed, or hopeless. Trouble falling or staying asleep or sleeping too much. Feeling tired or having little energy. If you have a poor appetite or if you're overeating. Feeling bad about yourself or that you've been a failure or have let yourself or your family down. Trouble concentrating on things such as reading the newspaper or watching TV. Moving or speaking so slowly other people would notice, or just the opposite, being so fidgety other people would have noticed. Or thoughts that you would be better off not here on earth or hurting yourself in some way. And then they give you not at all, several days, nearly every day. And then you fill this out and your doctor goes over it with you when you go in the office. The doctor will take a medical history of you, again, checking your blood pressure to see if it's out of control, seeing your pulse, seeing your height and your weight. Your doctor may also get I think I have it with me. A waist measurement. I got this at Joann's before they closed all the stores, sorry to say. But ladies, we need a waist around your belly button, less than 35. Men, you want it less than 40. And when you do this, you don't want to go, and then take it because you're cheating, okay, if you know what I mean. Just do it with you, just be normal, okay? And if it's above those levels, 35 or 40, then the doctor and you can go over ways to bring your waistline down. Talk about your diet and use of alcohol. There's another type of dementia that's alcohol use. If you're drinking a lot of alcohol, that can cause dementia-like symptoms, okay? Your medical conditions present in you and your family. Again, if you have a history of Alzheimer's in the family, make sure the doctor knows. If you have a thyroid condition, let the doctor know. And cholesterol, if you have a problem and you're on cholesterol medicine, the doctor would like to know that too. Okay? As I said before, there's some medication that can cause dementia-like symptoms. Not everybody has dementia-like symptoms from being on these medicines. But some people on anti-anxiety medicine or sleeping pills like lorazepam or Valium, Ativan, sometimes they can cause or are suspected of causing symptoms of dementia. Anticonvulsants, Dilantin, phenobarb, sometimes can cause dementia-like symptoms. Antihistamines like Benadryl or Zyrtec in some people can develop those symptoms. Some anti-Parkinson drugs like L-Dopa can cause that, and some heart medicine like Tenormin, low pressor, warfarin, atenolol, metoprolol. Not in everybody, okay? If you're on those medicines, you don't have to call your doctor right away and say, oh my gosh, change my medicine. It doesn't happen in everybody. So there's some of the medicine, and like as I said before, the statins, some research has shown that it can cause dementia-like symptoms in that as well. So let the doctor know if you're noticing a lot of forgetfulness. The doctor will do a mini cog on you where he or she will give you a piece of paper, give you a circle, and say to you, can you make the numbers on a clock and then write 11:10 on that clock. Now, it was interesting. I am a registered nurse too, and I did this with one of my patients, and he put all the numbers on one side of the clock, and the other side was totally empty. So I did encourage him to see his doctor and told his family. And unfortunately, he did show more signs of dementia. But it's important to have that mini cog done. Also, the doctor will ask you, I'm going to tell you 3 words, and I'm going to ask you them later. So try to remember the 3 words I tell you. I don't know if any of you have had that done at the doctor's office. Okay, and that's part of the mini cog test to check how your cognitive health is. The doctor will also do blood work. Okay, maybe you didn't have problems with your thyroid, and now all of a sudden your thyroid levels are really abnormal. If you get put on thyroid medicine, the dementia-like symptoms go away. Okay, so there's some conditions, vitamin B12, maybe it's real low. You get put on vitamin B12 and you're doing better. So some people on who have trouble with their iron may show signs of dementia-like symptoms. Once they're put on iron tablets, may do better. They may do a urinalysis of you as well, the depression screen. They usually won't do a CAT scan or PET scan unless they really find that they need that. Okay, if you're truly showing signs, if all that other stuff is ruled out and they find that, oh wow, you may have dementia symptoms, let's check a PET scan to see if you have any towels in your brain that show up. Now, as I said before, they have their first blood test for diagnosing Alzheimer's, Lumipulse blood test. It's not as invasive as a brain scan or spinal tap, and it has been cleared by the FDA. So if you would need that, you can talk to the doctor, or if a loved one needs it, talk to the doctor. They won't do it in everybody. It's not done on people who are healthy, okay? But if you're showing signs of dementia or forgetfulness, they may order that. Yeah, Annette.
Is that only for Alzheimer's detection, or will it detect
Other dementias. Yeah. Okay? Because they'll put everything together. It's not just one and done. They'll put the blood test and the mini cog and what you're telling the doctor or your loved one's telling your doctor, and your blood work, your other blood work, if your blood sugar's out of control, if your blood pressure's out of control, they'll put everything together. Okay? But that test was just approved in May of this year. Okay? And the test is not 100% accurate, but it's much better to have that test done if you're showing signs and having all those other cognitive tests done as well. Sure, it's Lumi, L-U-M-I, Pulse, P-U-L-S-E. It's one word. Okay, blood test. Most people address concerns about memory, thinking, or behavior with their primary. However, sometimes your primary will then send you to a specialist. And these are some of the specialists your doctor may send you to. A geriatrician is a medical doctor who has special training for people and diseases in older adults, generally over 65. The neurologist, who specializes in diseases of the brain and nervous system. It's important to note that not all neurologists specialize in Alzheimer's and other dementias. My son has epilepsy, so he sees a neurologist who specializes in epilepsy. He wouldn't go to the Alzheimer's doctor, okay? Neuropsychologist, who can assess, diagnose, and treat psychological disorders associated with brain-based conditions. Psychiatrists, who specialize in disorders that affect the mood or the way the mind works. And psychologists, who have special training in testing memory and other mental functions. Okay, what are the benefits of early detection? And Ruth is going to tell us about that.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
Okay. And just as a recap, pay attention to any changes again in behavior, memory, thinking that you notice in people. If you see changes that are unusual, take action, have a conversation. You can use the 10 steps to approach memory concerns. And again, like Ruth said, there's a lot of benefits to early detection. Opportunity to plan for the future, explore treatment options, and participate in clinical trials. Okay, seeking diagnosis. Here's a little quiz question for you. There is currently no way to diagnose Alzheimer's disease. How many thinks that's true? And how many think it's false? All right, you ladies and gentlemen are right. There are a number of assessments and tests that make it possible for healthcare professionals to diagnose Alzheimer's with a high degree of certainty. Okay? And the medical history, the physical exam, screen for depression, the lab test, brain imaging, we talked about them. Okay, do dementia-like symptoms always result in a diagnosis of Alzheimer's or another dementia? Correct. No. It could be another medical condition. Okay? The Garcia daughters are writing again. Appointments have been going well. Mom's handling them okay. Think it's really dementia? Guess we won't know until we get a diagnosis, but let's talk to Dr. Salloway.
Someone could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
And try to make sure if you have dentures, see your dentist. I know a lot of people have told me, oh, I don't need to go anymore to the dentist because I don't have teeth. You could have gum inflammation. Inflammation in your gums can go to your brain. So they've done a study, and actually they did this last year in Philadelphia at the Alzheimer's Association conference, they talked about how important periodontal disease is with cognitive decline. Get it taken care of. They also discussed constipation. I won't go into a lot related to that, but if you have not had a bowel movement for 3 days, they found you're at increased risk of cognitive decline. So make sure you talk to the doctor about getting more fiber in your diet, okay? Again, hearing test, eye exam is really important as well. Okay. The diagnostic experience may vary from person to person. Stigma and misconceptions about the disease, like believing that nothing can be done, can prevent some people from seeking a diagnosis, and something other than Alzheimer's or another dementia could be causing the symptoms. So what's next when the diagnosis is Alzheimer's? Well, they talk about it, and they found that mom did have early stage Alzheimer's. Doc said to contact the Alzheimer's Association, and the one sister left the office with some hope. So the Alzheimer's Association is there. Okay, it's in all states. Okay, and the mission is, actually, that was very light. Let's see if we can get it up. Is there a great resource for people to contact and get help? Okay, they're available wherever and whenever you need reliable information on the phone, online, and in communities. Okay, and also if you get the diagnosis, there's groups now that can help you, and there's memory fitness care. Jefferson Lansdale has a senior center, okay, and they do have a memory care unit where they meet there once a week, and at the Warminster campus, they have it, Monday through Thursday, and I have the numbers if you need them, but they're activities to stimulate the mind, and they're memory fitness specialists, physical exercise, games, puzzles, literature discussion, current events, guest speakers, music. Music therapy has been proven to help with dementia quite a bit, okay? And also keeping dementia at bay on a budget. They have dementia cafes now too, that you probably can talk to the Alzheimer's Association about as well, where you can bring your loved one and their loved ones are there too, and you can discuss, and they can have people who are experiencing the same things they are. So it's wonderful for them, and it's a wonderful outlet for you too, to have someone to support and understand what you're going through. We do the Alzheimer's Walk every year. There's one in Lehigh Valley in Bethlehem, and there's a number of them, but we go to the Philadelphia one quite a bit, and there's thousands and thousands of people who are there, and they raise funds for research since they don't get research anymore, research funding. So we need to continue to make progress in the drugs that people use and find out more information about what's going on with people's brains. There's a number of flowers they give out at the run or walk for Alzheimer's. Blue is saying, I have Alzheimer's. Purple is, I have lost someone to Alzheimer's or another dementia. Yellow is, I am caring for someone with Alzheimer's. Orange is, I support the cause and vision of Alzheimer's. And white is to have a future with no Alzheimer's or other dementias. That's their mission, to have research, find a cure, and have people not have Alzheimer's at all. Just like that 50-year-old I told you about. Have people be on medication to slow the progress and hopefully someday stop the disease. Did you have something to say, ma'am? Did you have your hand raised? Oh, okay. All right, does anybody have questions? I know that's a lot of information, but can you relate to some of those warning signs? Or do you know someone, a loved one or friend who may have had some of the warning signs? If you do, maybe you can have a talk with them or their family about getting that person checked by their primary and then getting seen by maybe a neurologist or one of the other specialists. And then also having a special PET scan, MRI test, a blood test done to see if it's truly Alzheimer's or another dementia, or is it some other medical condition? Yeah.
How do you differentiate Lewy bodies?
They can tell by some of the tests they do, okay? I know some people who have Parkinson's have Lewy body dementia. So they have certain tests that the doctor would do, and they could tell, okay? No, they still have a lot of the same symptoms. All the dementia, the umbrella, a lot of the people will have this similar symptoms. Oh, really? The Lewy body? Okay, yeah. They may, again, everyone may not have the same symptoms. Maybe one person will have the continuous question, asking questions, same. Another person will accuse others of taking their shoes, okay? But the doctors who specialize in dementia and Alzheimer's will be able to zoom in and tell the people exactly what type they have. My mom had a stroke, so it was pretty easy to see her vessels were full of plaque, not only around her heart, but up into her brain. So that was pretty easy to see with her. And with Lewy body, they probably have some other special tests to do for that person. But you've known a couple who have the Lewy body recently. Did they have Parkinson's as well? Okay, because I know two people who have Parkinson's and do have Lewy body. So, any other questions? Thank you so much for coming, everybody. I hope you learned a few things. Okay? So, I appreciate coming out today and having you all here and listening. Okay? Thank you.
Thank you, Jane.
Oh, sure, Ned.
I wasn't sure if this was on or not. Jane has presented for us over at Doc Woods, and then she is going to be doing this presentation at Doc Woods as well. And I think the one you did originally was on the diet, the healthy,
body,
healthy body, and heart. So that was great. How many, just out of curiosity, how many people here have personally been touched by someone who has a form of dementia, either a loved one, a family member? Yeah, many of us. Yeah, my father passed with Alzheimer's. So this is a very, very relevant topic. As you said, Alzheimer's is growing in numbers. So the more we can learn about it, and the earlier we can get doing something about it, the better we are all going to be. So I really, when I woke up this morning and I saw this muggy, yucky day, I thought nobody is going to show up for this presentation. Jane and I will have a nice conversation. So thank you very much for coming out today. And thank you, Jane. That was great information.
Thank you. I'll try to find some information out for you.